This video will demonstrate a full arch reconstruction using the GuidedSMILE Chrome system. CT scans were taken of the patient, who was an 84-year-old female who did not want to wear removable dentures. The case was planned out and the appropriate pre-laboratory work was done. On the panoramic x-ray, we will see that she has no posterior osteostructure which would allow us to put implants in that area. Consequently, an all-on-X approach was decided to be appropriate for this patient. To help aid in bleeding during the surgical procedure, an incision was made using an electrosurge device. This was done in addition to the use of a standard 15 scalpel. A full thickness flap was raised and the tissue was elevated as high as possible in the upper anterior region. This is important to allow the fitting of the pin guide. The use of a 2mm drill is used to create transverse osteotomies to hold the various modular components into place. Pins were placed and were seated via the use of a surgical mallet. Once the osteotomy guide was fixed in place, the pin guide was removed. As you can see, the guide does not touch any of the labial bony tissue. With the guide in place, routine exodontia was performed and the 5 remaining teeth were removed. Once the teeth were removed, the palatal flap was raised so as not to interfere with the osseous reduction of the alveolar ridge. At this time, a bony reduction was performed using the Chrome osteotomy guide. High-speed drills and low-speed burrs were used to create a flat, flush surface that is even with the occlusal surface of the osteotomy guide. Once the bone reduction is complete, a clear plastic carrier guide is locked into place using the Swiss locks. It is imperative that the clear plastic guide sit passively on the bone with no binding. This is crucial in terms of assuring that the plane of occlusion of the nano appliance does not change from the prepared laboratory procedure. If any binding does occur, find the high point in the bone and reduce the bone. The osteotomy guide is pinned into place and the guided surgery takes place according to the manufacturer's instructions. The implants can either be placed through the osteotomy guide or, if preferred, the osteotomy guide can be removed and you can begin placing the implants. (40 to 50 Newton-centimeter of torque was achieved on all of the implants. The carrier guide was then seated and the multi-unit abutments were placed. Again, it's crucial that the multi-unit abutments emerge through the carrier guide without impingement. The abutments are torqued to 20 to 25 Newton-centimeter and then the nanoteeth are adjusted and fitted over the multi-unit abutments. It may be necessary to widen the openings for the multi-unit abutments so that the nano can fit passively. The flange of the nano is sitting flush against the carrier guide. The carrier guide simulates 2 to 3 mm of tissue in the final prosthesis. Gaskets are placed over the pickup cylinder to prevent the pickup material from entering up into the carrier guide. The nano is held into place and pickup material is injected around all of the transfer abutments. Once the material is set, the nano is unscrewed and taken to the laboratory for final finishing. At this point, comfort caps are placed over the abutments to make sure the tissue does not encroach over the abutments during the lab work. Appropriate bone graft material is placed as needed. This is all happening while the prosthetics are being finished in the laboratory. 4 ovicral sutures are placed and the tissue approximated. The appliance is then delivered to the mouth and screwed into place. Post-op pictures show the before and after images of this patient.